You were talking about how the neural pathways change by literally sitting in front of a computer.
Yes.
And you know, to me, what hit me like a ton of bricks is that we are a culture that is now sitting in front of a device that is altering our brains. I mean, we're literally evolving our brains in many ways not in good places. And you mentioned that people that never had sexual compulsions that are now in their 60s, 70s, and 80s are seeking out treatment for out of control sexual behavior because of the imagery that they have access to that they never had access to. Like 10 years ago, you couldn't find stuff that you can find in 2 seconds on the internet that is so explicit, that is so vulgar, that is abusive, that and what's weird about it is it's because it's sex, it's sexually charged. And there's a curiosity, a morbid curiosity to look at the stuff, to be consumed by it, and this is accelerating at a rate quicker than probably anything, and that's why I think it's so important to get this message out to people to look at this sort of stuff.
I mean, it is true that for the first time in my career in the last 5 years, I've had to really cope with geriatric sex addiction. I mean, none of us were ever trained for this, but it just started showing up in where you're having elderly who are having trouble with it. But there are other changes happening, Joe. One of the things we're seeing is women. In both gambling and sex, the internet has changed addiction. Because women will take risks on the internet that they won't take in other environments. It'll be unusual for a woman to go into an adult bookstore, for example. But on the internet, she'll try. So 40% of the people who are in trouble are now women, and they're doing very male-like things, putting themselves in extraordinary jeopardy. Meeting people who are dangerous, part of high-risk people. We have a significant challenge in this culture. We now know that addictions aren't just a myth that you have to take a chemical. You can be addicted in many ways without using chemicals. Sexual addiction, we're now at a place where we have an epidemic, or we have 2/3 of our kids watching pornography while they're doing their homework. And
2/3 of kids watching pornography while they're doing their homework. I wanted to highlight that. That's
34% of them go on to really pursue that and are at risk for what we call sexually compulsive behavior. The problem is this whole field has changed, because when I started, I would hear guys talking about finding their father's Playboy collection. And now I'm hearing people talking about that the level of stimulation, what they're finding on the internet, the answer is no spouse can compete with the internet. Plus, we have drugs we didn't have before. We understand about work and stress, things connected with stress, how it changes the brain. And so it's a time where we're talking about our most significant health issue in this country. And we're blind to it. Because if you look at all the kinds of issues that are involved, it's our most expensive thing medically, it's our biggest problem socially, it's our biggest problem in schools, and it's our biggest source of crime, and it's our biggest source of injury for children, and we as a culture do not want to deal with it.
There's behavioral addictions such as sex, which we're going to talk heavily about today, gambling, eating, internet, and then there's chemical addictions, alcohol, drugs, things that are consumed. Is there a difference between a chemical addiction versus a behavioral addiction, other than the way that it's acted out?
Well, what's important is that everybody understand it taps into the same parts of the brain. So it's the same reward centers, uses the same chemicals like dopamine, for example. If you have a good meal, it raises your dopamine 50%. If you have sex, it raises it 100%. If you drink alcohol, it raises it 100%. You take methamphetamines, raises it 1100%. So sometimes some things are too good. The brain you can't be a recreational user of meth and not have a problem, see? And there are other things like that. So the first thing that you need to understand is it taps into the same parts of the brain. What makes it different, and especially with food and sex, they are different than everything, which is why many of my patients will say, heroin addicts, cocaine addicts will say, by far, sex was much more difficult than their cocaine or their heroin. And part of the reason is, first of all, the brain will categorize anything sexual, both men and women, 20% faster than anything else. We are wired to be sexual because it's about survival. Food is about survival. Food and sex are also sensate. So a cocaine addict doesn't care how his cocaine is packaged.
Right.
Just wants the cocaine. But food and sex, presentation can mean a lot in terms of what does it mean to the person, how that person looks. Just think of words, Joe, that you can think of right now that would apply to both food and sex. Hunger.
Delicious.
Yeah.
Beautiful.
Yeah, exactly. In other
erotic.
words. Yeah, right. So you have.
See how my brain just works like this, Pat?
Yeah. But the point is that they're regarded as two of the toughest addictions because of how they're wired, and then they are intimately connected also with historically issues around trauma, sexual abuse. Many people who are overweight have been sexually abused. It's a way to defend themselves sexually. Right. Sex addicts have been abused sexually. Fear is a big factor in all addictions. Every addiction has what we call a stress factor. You really can't have an addiction without stress because of what it does to the brain.
Interesting. Well, okay. Well, first off, I would be fascinated to know why that is the case, but I want to first have you define what is addiction. I mean, what does that mean?
Well, there's many definitions of what an addiction is, but here's what it boils down to. Addiction is a brain disease. The brain has become altered, and when a person starts a behavior, like a kid takes some nicotine, what he doesn't know is nicotine stays in his brain for 30 days, so he doesn't feel like he's got a problem. I haven't had a cigarette in 3 weeks. Right. But the fact is, the brain is adjusting, and so it feels like a choice when he starts. And what happens if he uses it to cope with stress and cope with pain, the actual way that the brain is structured shifts. It moves. Even in gaming, we are now seeing that kids become so addicted to gaming that we are quite certain, some kids' brains don't actually unfold naturally. So what happens is that the brain is altered and it's self-administered. You do this for yourself and has a lot to do with how you perceive things. So, for example, you and I were joking before the show about this research out of Stanford where people were given a same bottle of wine. One group is told it's $90, other group is told it's $10. The group that got the $90, they got higher than the group that had the $10 wine.
So same wine, one group thought it was $10, the other's $90.
Yeah, so it's really what your perception is. And so what happens then is that the brain actually then starts to reset itself, recalibrate itself. And then that person gets to a point where it crosses the line. It goes from where it's an impulse to where it becomes compulsive. And then it becomes addictive. And then you have a problem where a person can't stop. And they make promises to themselves they're going to stop, and they can't stop. Because the brain is now at a place where it can't go backwards by itself. There's a great guy who wrote about the money disorders this way, by the name of Jacob Needleman. And he says, you always know that addiction is present when the person is living in contradictions. So the sex addict might say, I love my wife, but then he's unfaithful to her. Parent, I love my children, but spends no time with them. They're contradictions. And the only way that addictions work is when there's contradictions like that.
Interesting.
So your question about how do you know that you're in trouble is when you're doing things that you don't feel good about afterwards, and you promise yourself you're never going to do them again. In fact, we have a little scale that physicians now use because physicians they're starting to look for the problem. Emergency rooms and urologists, and I mean, people get into trouble physically, or STDs, what have you. And if they are preoccupied, can't stop thinking about it, if they have, if they've harmed others, if there is some abuse, if they're ashamed of their behavior, if they're sad, and if they have sought help for it and it's been unsuccessful. These things are indicators. The internet is changing everything. It's changing our sexuality. It's changing our culture. no spouse can compete with the internet. And
what do you mean by that? No spouse can compete with the internet?
because, you know, I mean, I think of in my marriage, I've been married to my wife Suzanne since 1995. And just what it takes to deal with her. I mean, she is, to have a good relationship takes so much work and stuff to deal with one really good woman. And it's kind of how we have evolved over time, is to be able to deal with a person one at a time. Most cultures find that serial monogamy at works best. However, when you go online, you're looking at 50 pictures. And you pick one and it takes you to another deal, and there's 50 pictures more like the one that you picked. And so it becomes a selection mechanism. And it takes you to a place where it gets you to some of the deepest places sexually that people live. And so you can be instant messaging 5 people. You can have the amount of stimulation. Remember what I said about you can't be a recreational user of methadone? Right. Okay, online, if you really get into it, it gets to a place, especially if it gets to what we call accessing the unresolved in people. And what happens online is people get into things that they can't do.
Right.
They just can't do.
But it's erotic, it's arousing, and so it just wires the brain.
Yeah, and there's a word that we use called the MESA factor, which means machine-enhanced sexual arousal. Takes the brain and elevates it to a level that requires so much stimulation that being with just a woman doesn't do it. I hear that from my patients all the time, and there's recent New Yorker cartoon where the guy rolls over, honey, it just doesn't work if it's not on the internet. No joke. That is where it gets for people, and the problem is you get kids who started when they're in the 5th grade. Like, there's a new book out that just a study of 100 universities involved in this study, and they asked, when did you start looking? And I think it was like 40% of the men and 36% of our current college-age students started looking at the internet sexually before the age of 10. And parents haven't a clue. Joe, we have a tsunami coming. We have a tsunami coming, a change in sexual behavior. It's going to take us 100 years to see what it does to the species.
What if someone has a sexual addiction and they don't deal with it? What happens?
Well, they'll go through a lot of partnerships. They'll have big losses. They'll end up in jail. If we ever get some of the strains of HIV that are in other countries in this one, and it starts, I mean, we will have just a nightmare.
Just a little bit of my background before we start. I want you to just, I want you all to see me, if you can see me. I wanted to say that I am a sex addict, and I think that's important for me to say. I went many years, I've been in the field since I was an active sex addict from 14 to 25. I tell you that because there's no face for my disorder. You know, there are lots of people who tell you they're alcoholics, drug addicts, gambling disorders, eating disorders. Not many people come out and talk about having a sex addiction problem. And the issue, and the problem with that is if you don't have a face, then it's just some phantom on a screen, one of those sleazy, perverted people. Not that I'm not, but I'll just briefly tell you, I grew up in a home with a profoundly mentally ill mother. My mother was bipolar, and really the worst kind. She would cycle every 18 months. And 2 psychosis, 2 running down the street naked, 2 ambulances and into places like this, and then out in 4 days because she wouldn't stay. And that, or if she did, they gave her ECT and Thorazine, and then I'd come home and have a very different mom than the one who left when she was manic. So I grew up not very comfortable with or trusting of intimate relationships, or that attachment and nurturing would provide me with the needs that I had as a child. And that's a really hard lesson when you're an adult. And I would say that almost all the clients I work with have some kind of underlying intimacy disorder or problem with making use of healthy attachments in order to get their emotional needs met. Doesn't mean they don't get married, doesn't mean they don't get in relationships, but they're not honest with their partners. They keep them at a distance. They make up all kinds of things in their heads about them, and then they go out and act out. I have worked in the field, as I said, for about 22 years. You heard that Pat Carnes was I got to work with him in a residential setting very much like this for about 4 years. So I really learned in residential treatment everything you can probably know about working with sex addicts, both male and female, and I've done a fair amount of work with offenders. So I have a pretty well-rounded experience. I've written 4 books on the topic, one for gay men who are sex addicts, since I am a gay man as a sex addict, and there wasn't a book, and that book is called Cruise Control. So if you ever run into a sex addict who is gay and they say to you, oh, well, you just understand this is what gay guys do, meaning having 100 partners a week or something, get the book and read it. You'll understand that's not what gay guys do. That's what sex addicts do. And you know what? You can be straight and do that too. So, and you can be a woman and do that too. So I've written a lot and have a great interest in technology and the intersection of digital technology and sexuality, digital technology and intimacy and relationships. I'm going to talk some about that. Those of you who are parents, I'll talk a little bit about all the porn your kids are seeing and all of the new ways that they have of addressing and interacting with each other. And you might find I have a slightly different perspective than most people do on the topic. I find the best way to talk about this topic is to talk about what it isn't, because I think there's a lot of misnomers and a lot of mythology about this, both good and bad. So I'll go through this fairly quickly, and then we'll start to talk about what it is. First of all, you know, and before I do that, let me tell you who I have coming in to see me. My average client is a 30-year-old, my most average client who comes in for sex addiction, just pure, that's my problem, they're not drinking and using, they don't have other major mental health disorders, they're mostly functional, and I've seen that population since I started. My average client is a 35-year-old male who has been married for about 11 years, maybe 10 years, has 2 children under the age of 8 at home, has been acting out sexually a lot in adolescence and early adulthood, or problems with intimacy and relationships. Wasn't really recognized as such because that's what a lot of teenagers and young people were doing. He found a girl, she was the one. They fell in love, they were drawn to each other like in West Side Story, you know, just like instant pathology match, you know. And she's somewhat intimacy avoidant, him somewhat intimacy desperate. They fall in love, they're completely attached, they have sex every moment, they can't get apart from each other, everyone thinks they're a wonderful couple, they get married, and then somewhere about 2 years in the relationship, he returns to the sexual acting out that he began, that he was doing before they got married. And he, by the way, thought, well, I don't really have a problem with sex and intimacy, I just had never met the right person. Because when he meets her, he's like, oh, this is it, I've got it. And then something happens that causes him to start to act out sexually again during the course of their relationship. And I'm not talking about the occasional affair or seeing or going to a strip club. I'm talking about repetitive patterns of problem sexual behavior that go on and on and on and on and on. So, by the way, what do you guys think, and this is audience participation, might be the trigger for him to returning to act out in my most common patient? What happens at 2 years in the marriage that you think leads them to him to, pardon? They talk about having children. And her gaze turns away from him for a second and starts to go to her body and childbearing, and then there are children, and he starts to get internally resentful. Why aren't I getting the attention? Why aren't I getting the focus? Because his narcissistic wound is uncovered because he's not getting that seal of perfect attention from her. And so he starts to look for, in his mind, he starts to devalue her. You know, we haven't had sex, we're not having sex anymore. I mean, ever since she had those kids 45 days ago, we're not having sex anymore, and I don't get it, and she doesn't look like she did, and I'm not, you know, so he starts to build a case, and then he goes out and starts having sex with prostitutes or looking at lots of porn. And then about 6 years later, she goes to the computer and she finds thousands of pictures and all these email contacts, and she says, what's going on? And he said, oh, it's just a guy thing, it's like Playboy, it's what my dad did. And then she doesn't feel quite comfortable with that, so she goes to the computer and actually finds out that there have been affairs and sexual contacts and all that stuff. And then she says, I'm not going to put up with this anymore, you get some help or you're out of here. And that is what I call a wife-driven referral. And that's about 60% to 70% of my referrals are something like that. What I usually find that these men have underlying attachment disorders, early sexual trauma, Sometimes they have developmental or personality-based issues, all of which lead them away from intimacy and toward intensity. My clients seek intensity when what they need is comfort. So that's my basic client. I would say the other population that I treat, there's two others. One is women. And I've been working, I was fortunate enough to be the person who was able to develop the only dedicated programs for women in the United States who have sex and intimacy disorders. There are two of them now. And I learned a lot about women from that. You know, much higher rates of sexual abuse in the female population, much higher rates of chemical dependency unresolved, much higher rates of eating disorders unresolved. These women bounce back and forth from chemical dependency programs to eating disorder programs, and guess what? No one ever asks them about sex. Or if they do, they ask them about their sexual trauma, but they don't talk to them about their current sexual lives. I don't understand. I assume most of your clinicians working in or around facilities in some way, or you may see clients yourselves and interview them. It makes no sense to me why someone can go into a treatment center or a mental health institution and they get asked about exercise, eating, spending, education, social life, family issues, and no one asks them about sex. That doesn't make any sense to me. Because I know that a lot of people have sexual abuse, a lot of people have intimacy disorders, a lot of people have those kinds of issues, and they will act out over them and they will relapse over them. So women will frequently relapse over their sexual behavior or their relationship problems. Men will pair sexual behavior problems with drug disorders, like meth and sex, like coke and sex. I have a whole population of transgender and sexual orientation confusion guys who drink and use because they hate themselves for what they feel they are, and so they go out there in order to have the sex they like, they drink or use, or in order to tolerate their feelings about the kind of sex that they like, they drink and use. And they also can't get sober because they hate themselves so much for their sexual issues. So there are a lot of ways that sexuality plays into relapse for drug addicts and alcoholics, and that is another area of great interest for me, and we have programs for that. So what sex addiction isn't? First of all, it's not diagnosed if I have a pre-existing major mental health disorder, so that is driving the hypersexuality. You know, people who are manic can be hypersexual. And when they're stable and no longer manic, they're not hypersexual. So that would not be a sex addict. Someone might have OCD and be very compulsive about masturbation along with counting all the ceiling tiles and whatever else they're obsessed about, and yet when they're stable on medication they stop compulsively masturbating. So I have to rule out those kind of diagnoses before I say, oh, this person has some kind of addictive sexual disorder. Sex addiction is not fun. Sex is fun. I hope it's fun for you. Intimate sexuality is fun, relational sexuality is fun, recreational sexuality is fun. So's drinking. For most of us, have a glass of wine, have a few beers, maybe get drunk at New Year's, not a problem. But if you're an alcoholic, drinking is not so fun. And for that small percentage of the population that has a problem with alcohol, they cannot drink like everyone else. And drinking for them is driving into trees, hitting their wife, losing their job, all that. And so for a sex addict, which is a small percentage of the population, those people don't get to have or are unable to have the kinds of recreational, non-intimate sexual experiences that most other people can have, because once they start down that road, they run off the rails, just like an alcoholic, just like a compulsive gambler. That is their problem. So the problem is not sex, and the problem is not having fun with sex, and the problem is not having a lot of sex. The problem is what goes on in your brain, the person who is engaging in the behavior, when they get involved with non-relational, objectified sexual experiences and where they end up. I work with people for whom I work with people whose sexual behavior has caused them to lose their jobs, to lose their relationships, to get arrested, to get diseases, to pass on diseases. And they don't just do this once, they do it multiple times over the years, and they clearly have early either developmental or emotional or attachment or trauma challenges that have driven them to avoid intimate relationships and to seek out intensity-based experiences as a means of escape. So there's gender dysphoria. How many of you work with crystal meth addicts? Or have? Can you keep your hands up just so I can see? Okay. I have a message for you from that community. Please talk to them about sex. And don't just talk to them about the sex that they had when they were using, but they really need to talk about that. Because a lot of people will engage in sexual acts when they're high that they later have shame or embarrassment about, but they've never told anyone. And as my friend Pat Carnes would say, sexual secrets are the ones that we often have the most shame about, and they're the ones we're least likely to tell anyone. So they're dying to talk about it. And crystal meth addicts in particular, and coke addicts as well, stimulant addicts in general, often engage in a lot of running off the rails sexual behavior. They need to talk about that because you don't want them leaving here carrying that shame around. Or leaving wherever they are. The other thing that I would bring you from that community is they need to talk about what is sober sex. If you are a crystal meth addict and you've been running off having sex for 3 days with strangers doing Viagra and not sleeping, and you're used to doing that a couple of times a month, going out and having a date is not going to be very interesting. Having sex with one person is not going to be very interesting. These people, both straight and gay, will return to the people and places where they found that really hot, intense sex, and guess where the drugs are? So they will go back to the prostitutes, the bathhouses, the clubs, whatever it is, seeking that intense sexual high because it was paired with the drug use, and then they end up getting high again. And if you don't treat them for sexual issues as well as drug issues, they will relapse over that. And those of you who treat meth, and I have strong feelings about this myself, know that the relapse rates are like in the 80%. You know, they're really, really high. And so I want to give someone who has a meth or a stimulant problem every opportunity to get well, and that means that I have to talk to them about what their sexual behavior is going to be when they leave treatment. About 90% of the people that I treat are engaged in consensual sexual acts that are repetitive and problematic because of their repetition. They're not crossing the boundaries for the most part into offending behaviors. Now, some are offending online because online offending is not illegal in a lot of ways that it is in the real world. Some people do run off the rails online, but in general, my folks are not trying to make people be sexual with them who don't want to be sexual with them in any way. They're looking for the approval. They're looking for the validation. They're looking to be desired and wanted. It's a narcissistic wound that they're trying to feed over and over again. So they would not want to push someone into something that person would be uncomfortable with because they don't want to see the unhappy face. They want to see the I want you face. So most sex addicts don't offend. Now, what are they doing if they're not offending? Well, here's typical stuff that sex addicts are out there doing. They're compulsively using porn with or without masturbation. And today, as you probably know, you can use porn with your phone. So it's pretty easy to 24/7, wherever you are, gather up some porn. They're anonymously hooking up with people they meet online and with their phones. They're going to adult bookstores and strip clubs. They're exchanging sex for drugs or for favors, and I see this a lot in women, where even women with means will sell themselves for money or gifts or drugs because it gives them a sense of power. And so for these women, they don't prostitute themselves necessarily to pay the rent. They do it because maybe they have sexual abuse issues, and this is a way of kind of acting it out in a way where they feel a sense of control. So even though you're using me, you're paying me, so I've got you, and that's unlike what I grew up with when I was a victim. So that's not unusual for the women. Sex addicts are seeing prostitutes. They're going to sensual massage parlors. Do you have sensual massage parlors in Virginia? Yeah, someone said yes. One person said yes. One brave person. So I love that word because I have clients who come in and say, "Oh yeah, I don't have problems with sex. I just go for sensual massages." Okay, how often do you go? 3 times a week. Okay, you must need a lot of massage. So, so you see prostitutes 3 times a week? Oh no, I don't see prostitutes. You know, because no man really wants to be caught seeing prostitutes because that's an insult to his ego. So, well, let's see, you lie down at a table, they rub you all over with oil, they masturbate you to orgasm, then you pay them money. How's that not seeing a prostitute? And that's simply confronting denial in my world, because if I can get that person to own something they don't want to own, I've sort of shifted their thinking a little bit. So sex addicts going to prostitutes, to massage parlors. They're cruising, they're intriguing, they're objectifying. There's always some kind of sense of, you know, ooh, who can I get to get something going? Whose card can I get at lunch? And it isn't just about sex. It's also about who can I flirt with? Who can I get a card from? Who can I depend on to meet up with me later? It's about intrigue, really anything that will feed adrenaline, a rush of adrenaline, endorphins, dopamine, and all that nice, all those nice internal drugs that process addicts use to get high. Sex addicts will push boundaries. They view no as a challenge. We often have professionals who are in treatment, physicians, attorneys, therapists who are crossing boundaries. I'll have a doc, for example, who, let's say he's a pediatric doctor and he's treating someone's child, but having sex with the mother and saying, well, I'm not having sex with my patient. You know, that kind of pushing boundaries where they can justify it to themselves. They have multiple affairs, either one after another or often they'll be having an affair, and they'll be seeing a prostitute, and they'll stop off and see an old girlfriend on their way home. So they have multiple things going on. They're kind of juggling sexual and romantic experiences all at the same time. They're more and more using their smartphones for hookups, using apps, and we'll talk about that. They're sexting. Anthony Weiner would be the most famous case of that. They're abusing social networks. They're engaged in virtual sexuality because there are virtual sexual worlds now. As I said, they cross professional boundaries. And most of all, they live a double life. You know, sex addicts, by the way, sex addicts are great in treatment if they're not also drug addicts because they're so awake. You know, my clients don't take 3 weeks to clear before they're ready for treatment. They're already living 3 lives. You know, I just have to get them down to one that has integrity where everything is talked about, and they are much better really quickly. They're not better in the initial wounding that they had. That's a long-term psychotherapeutic issue, but in terms of their shame, their self-hatred, that addictive cycle, the isolation they're living in, I mean, all that gets lifted in treatment. They become a lot more available and a lot more present pretty quickly. I did want to say something, by the way, about Anthony Weiner really quickly. I've not met him, nor have I assessed him, but I thought it was interesting in the media over the summer where this man was just brutally attacked again. And what was he attacked for? He was attacked because it came out that he had continued sexting women after he'd lost his congressional seat. And everyone said, why wouldn't somebody who's had those kind of consequences stop that behavior? I mean, what kind of crazy is he? But if you treat addicts, you understand that someone who gets a DUI doesn't stop drinking that night. You know, someone who is a gambling addict doesn't lose their kid's college fund and say, oh, I get it, I need to stop. They just go take out a loan. So it can take a while for people, even in who's had the most severe consequences, to stop their behavior, because the only thing the consequences does is push someone into crisis and hopefully into treatment if they're lucky. If they don't only get into crisis, then they might continue to engage in the behavior because that's their primary means of coping. So it made perfect sense to me that this guy would continue to do it after he'd lost his position because that's how he copes. What else is he going to do? His wife has left him. He has no job. He's sitting around his apartment by himself. Why wouldn't he get online and sex to women? I mean, that makes perfect sense to me. But I can understand as someone who doesn't understand addiction that wouldn't make sense. You would think, because most people have a consequence, like with drinking or drugs, and they say, oh my gosh, look at this consequence. I don't want to do this anymore, unless you're an addict, in which case you keep doing it. Because the reality is that we don't define addiction quantitatively. We define it qualitatively. How is this behavior or substance affecting the quality of this person's life, their functionality? Are they losing their ability to function effectively with their family, with their spouse, with their job, with their day-to-day life because of this behavior or substance, or both? And that's how we look at sex addiction, in the same way as we look at all the other addictions. How could somebody be addicted to sex? I mean, it makes sense that you could be addicted to drugs, but how could you be addicted to sex? So we have to touch on the process addictions here. Let me start with a little story for you. I worked with a guy who was a crystal addict, and he would binge on crystal when he got paid every other week. And so a couple of weeks ago, his boss said, I'm going to get you an extra bonus check because you've been doing such a great job this summer. And the guy thought, man, I can get some drugs. This is awesome. When's that check coming? And all week he kept thinking about how great it was going to be. He called the dealer. The dealer said, yeah, I got some drugs. He said, I'm going to get this check Friday. Friday came. He went to the bank. He drove downtown. He cashed it. He went to the dealer's house. He parked in this special spot. He called his girlfriend, said, I'm going to be busy all weekend, cleared the space. Went to the dealer's house, sat down. The dealer said, man, you're such a good drug addict and such a good customer. I'm going to give you a free hit. And he dropped a rock of crystal in a pipe, and the guy inhaled. Now, all of you can answer this question, I think, in probably the same way. At what point in the story is this man high? At what point in the story is he biologically and neurobiologically, is his state of consciousness altered, where he's not making good decisions for himself? He's thinking in a kind of laser-focused way, and he's lost his ability to have, to see the whole picture, if you will. I heard somebody say when? Yeah, I think when the boss calls and says, I got an extra check coming for you, and that's 4 days before he gets the drugs. And when he's driving down to the dealer's house, I could prove to you that he's in an altered state of consciousness, couldn't I? Because when he's in that car on the way to the dealer's house, I bet you his heart is pounding faster. I bet you his pupils are dilated. I would imagine his hearing is more acute. His breathing is more shallow. His hands would feel clammy and sweaty. He might have some sweat trickling under his arms. He wouldn't be thinking about work, girlfriend, what happened last time, the money that he needs. He is singular laser focused on getting there and getting the drugs. Anybody work with a drug addict who has had an experience like this? Okay, so one way to look at this is to say that you don't have to say they're high, but you can certainly say that their thinking is significantly altered by their fantasy arousal and their euphoric recall and all of that. And what I would like to say to you about the process addictions is that's what they're really about. It's not about the end point of the gambling or the sexual behavior. It's about losing myself in the neurobiological arousal of that rush or intensity. When I can completely bury myself in the excitement about who I'm going to do, what I'm going to do, where we're going to go, and I'm going to spend hours and hours and hours looking for it online, on my phone, just kind of put everything else aside except the singular focus for this. While I'm in that state of consciousness, I'm not really worried about the fight I'm having with my wife, our financial problems. I'm not thinking about that trauma trigger that came up when my boss yelled at me. I'm not thinking about my kids and how am I going to. I'm not thinking about anything. When a spouse says to me, "I thought you loved me. Why? How could you do these things?" I think, well, when he was driving to see that prostitute, he really wasn't thinking about you at all. He wasn't thinking about anything. The only thing that was in his mind was getting to that house and getting into that experience. And I think that allows us to have a way to talk about this because it is the neurochemical release that's driven by the idea of and the fantasy about sexual behavior that people are looking to lose themselves in, not the sex itself. I don't know all of you, but I would guess that if you wanted to have a sexual experience from 0 to orgasm, that most of you could probably have one in about 10 or 15 minutes. I'm guessing, with the right stimulation. And so if sex addiction were about sex, why would someone spend 4 hours looking at porn? Why would someone spend 3 hours on their phone trying to find the right prostitute, the right person to hook up with, the right... what it is about is not the act itself, but it's about losing themselves in that whole run-up to the process. And they can do that for days or weeks. And remember, even if I'm 3 days away from seeing my affair partner, every time I call them, every time I send them a text, my heart, I get a little bit of a dopamine release, I get a little bit of adrenaline, I get a little bit of a rush of excitement. And in those moments, I'm really not thinking about or have to focus on the difficulties or challenges of my life. And, we all do this. We all have healthy escapes. We all think about the weekend. We all think about seeing our families and friends. We all think about that date we've got on Friday night. We all have these same systems in place, just like we all might enjoy a glass of wine. It's just for some people, because of their early experiences, because of how they are wired, they are able to extend those experiences into long periods of losing themselves in the rush of adrenaline and dopamine release. And I would, one way to think about sex addiction or compulsive sexuality, I think, is to think about gambling addiction or a gambling disorder, because they're very, very similar. A lot of it is about the excitement, the fantasy, what it's going to be like. And a gambler, they could have a stack of chips this high and have enough money to pay their kids' college fund back, pay their rent back. They don't stop gambling because they won. They'll keep gambling until every chip is gone again, or they can build it back up, because what they're into it for is the next turn of the card, and the next turn, and maybe that next card, and maybe it's really the hijacking of that emotional part of us that wonders over what's over that next hill. And that's how someone can lose themselves in hours of porn, because why look at one image when there might be another one, and another one, and another one? And so, and with that comes the adrenaline, and the endorphins, and the dopamine, and the arousal, and suddenly I've spent 3 or 4 hours sitting in front of this computer, or sitting and looking at my phone, when I really should have been doing this, working on that, whatever. What is sex addiction? Well, it's this state of consciousness that the people I work with call being in the bubble, call being in the trance. They call it, they say things to me like, I ended up at the adult bookstore, or my car kind of drove itself to her house, And now I'm a cognitive behavioral addiction person. I understand that they made a decision, that they made choices, we'll walk through all of that. But I also understand on some level, to them, it feels like they floated there. It feels like they kind of got there and they don't know how, because they are in that singular state of hyperarousal that is really, if you take the pleasure part out, the dopaminergic part out, and just look at the adrenaline, it's fight or flight. Now, I don't know, do you have major disasters here? You have floods, right? Hurricanes and stuff like that? Okay, so I'm just guessing if the sky turned green and you heard a bunch of bells and you saw water kind of flowing over the lawn, and there were some rattling of wind and all the windows started cracking, your heart would start to pound, your pupils would dilate, your hearing would become more acute, you would perspire a little bit, and you probably wouldn't really be hearing what I had to say at all. You'd probably be thinking about maybe one or two things. One of them would be saving your butt, and where do I need to go to get to safety, and the other might be your family, because everything else would go out of your mind because of that adrenaline rush. And that is fight or flight, that's survival. You know, that's where we come from. I mean, the guy who walked out of a cave and saw a lion lying there and said, wow, that's really beautiful fur, and I love that color of their skin, and guess what happened to him? That's not our ancestor, you know. It's the guy who walked out and saw a little bit of fluff and a little bit of yellow, and before he knew it, even though he didn't know he knew how to, found himself up in a tree looking down at that lion. That's where we come from. And it's because that adrenaline rush can produce the ability to leave our prefrontal lobe, to leave the part of our brain that abstracts, that has clear perceptive thinking, and put us in a much more primitive part of our brain, and which is where the people that I work with act out from. They're not thinking. They're not thinking clearly. You'll see all the elements of ancestral parenting, incestuous parenting, caretaking parenting, alcoholism, abandonment by father. I mean, so many of the issues that I see in the men that I work with. And basically a man who grew up learning that if he learned how to take care of his mother, he would be okay. And that's what a lot of the men that I work with have learned. If they can read the signals and look externally to see what you need to be happy, then you will take care of me and you will make me happy. And they learn that really, really early. So there are attachment problems here. So sex addicts are universally externally focused. They're not internally focused. They don't say, what makes me, what is creative and recreational fun that I can enjoy? You know, when I ask my clients what do they do for a hobby, they look at porn. What do they do with their free time? They pick up prostitutes. You know, so the idea of an internally resourced sense of pleasure, recreation, and joy really is not very well developed inside of them. However, externally, they're very, very good at picking up. They can look at a room full of people like this, and I could probably, if I was in an active stage of my disorder, pretty quickly tell who I could probably get something going with, who I might get, whose focus I might get, who has some trauma issues that I might be able to plow right through, because they are hyper aware of what's going on with the other. And that is how they are so able to manipulate and seduce and also live a double life, because they can lie, you know, and act this way to please that person and then act this way to please that person, because the goal is to make sure that they get taken care of by making sure everyone else is okay. And that's really how their thinking works, because that's often how they were raised. So, sex addiction is not really about sex, if that helps you any, and it's not really about orgasm. It's about the search for sex and the desire for orgasm. It's about the whole process, just like it is for a gambler, just like it is for a compulsive overeater. It's the fantasies, the looking, the searching, the hunting, the whole hyper neurobiological arousal state that I can put myself in when I start to intensely fantasize about and then act on sexual experience and sexual behavior. That's pretty much what my clients are struggling with. So where does it come from? Really quickly. And I mean really quickly, because we could spend a day on this. Sexual abuse, overt and covert. More overt in women. About 72% of the women we treat have overt sexual abuse in their history, and they are literally acting out what happened to them. Only this time they're winning. They feel a sense of control. You know, it's the woman who was molested at 13, learned she could, if she was seductive with her stepfather, she could control the time and the place. And so she learned seduction as a means of power and control. Even though she was in an out-of-control situation, she grew up thinking and believing she could have some control because she can control the time and the place. And then she ends up, you know, 15 years later standing on a stage stripping for 300 guys and feeling completely powerful and in control. And most of you ladies have asked you, wouldn't you mind just coming up here and stripping for a while? You probably would, the words power and control wouldn't come to mind. But for her, even though she had to have people escort her out to her car to keep her safe because she had money and she was beautiful, and she'd been stripping, and there were men in the parking lot who'd been watching her, she still felt when she was standing for all those men, she would say, I feel like I have them right here. You know, and guess what? Her heart is pounding, her adrenaline is pumping, her pupils are, she's in that arousal state when she goes up in front of all those guys and takes her clothes off. Early attachment deficits, social anxiety, social avoidance, any early experiences of not really learning how to deeply bond, make use of healthy social and relational experiences to feed myself, trauma, neglect, abuse. Parental enmeshment is a big thing that I was talking about earlier that I see a lot in the men, where men are asked to parent their mothers, or men are asked to or basically are only given the option to be loved when they are performing. I think Tiger Woods is a great example of that. Never met the man, haven't examined him, not assessed him, don't know whether he's a sex addict or not, but I do know in his story, and he tells it very clearly, that his father wouldn't talk to him or engage with him unless he was playing a good game of golf. And so what does that say to that child, except unless you're performing and pleasing me, you're not worthy of love. And that child will learn that lesson pretty quickly because children are pretty smart. And you don't stand out here and say, love me, love me, love me, and not get back what you need for very long if you're a smart kid. If you're a smart kid, you say, I get the problem. Problem is me. Problem is I have all these needs. Problem is that I am trying to get these people to be there for me, and they're not the problem. The problem is that I'm needy. And that to me is almost any addict I've ever met. Needless, wantless, 800-pound telephone, don't reach out to other people because they've learned to handle it on their own, to do it themselves, and to not make themselves vulnerable to the possibility that someone might let them down or hurt them. And I got to tell you, when you're picking up a prostitute or looking at porn or having an intense affair, you don't have to worry about being disappointed or let down or wounded. Because those are controllable situations where you can pretty universally expect that you're going to be adored, appreciated, and you can manage and be in control of the situation. So my clients will go downtown in a brand new car at 3 in the morning to the worst part of town and invite a prostitute and her pimp into the car and feel perfectly safe and in control. This is the last thing I want to give you, and it's all I really have time for, and I think it's important. What is drug and alcohol sobriety? Abstinence, thank you. And what is, so no mood-altering substances. What is gambling sobriety? No casinos, no fantasy football, no unsecured debt at the stock market. Okay. What is sobriety for an eating disorder? You don't stop eating, right? So with certain behaviors that are life-affirming, like sexuality and eating, when they run off the rails, we don't want people to stop. We want people to integrate them into their lives in a healthy way. So if I was working with someone with an eating disorder, we would look at, what is unhealthy eating for you? What is healthy eating for you? We would put that on a piece of paper. It would become a contract. We would sign it. And then they could go to meetings like OA and say, I've been sober for 3 months, 6 months. And that doesn't mean they haven't eaten in 3 to 6 months. It means they followed the contract. So it's very much the same in sex addiction. Sexual sobriety is a mutually agreed upon, clear, written, and signed behavioral contract that's based on the client's goals. The plans don't change without prior discussion with a sponsor or a therapist, very similar to eating disorder. So it looks something like this. What are the sexual behaviors that you need to stop? And these are often very specific. So it might be looking at internet porn, calling ex-girlfriends, cruising online for prostitutes, driving through the red light district, whatever those things are. And over here, this is where the clients get really excited. They're like, oh, this is where the good sex is going to be. And unfortunately, no. What this is about is how do you have regular, consistent, pleasurable experiences in life that don't involve high intensity? How can you have small dopamine drip, if you will? Because that's what most of us experience in life. We experience small joys and small disappointments. And once in a great while, we have a big joy and a big disappointment. But addicts want to have intensity all the time. And so a good friend of mine said once, recovery is, a life well lived in recovery is just one notch above boring. A life well lived in recovery should just be one notch above boring. I think that's about right. So I don't want my clients to have any mind-blowing experiences, to be honest with you, but what I do want them to do is start a recreational activity, start a creative activity, start spending more time with their family, start some meditation and prayer, depending on what that is for them, join meetings, join groups, go to therapy. So I do want them to do a lot of life-affirming and fun things that they haven't had time to do because they've been in the pursuit of sex. And all of this is based on their very clearly articulated goal for treatment. And I just want to say that every sex addict I've worked with, and when they've come into my office and I said, what are you here for? And they said, well, I want to be a better person. It's like, well, didn't you want to be a better person 3 weeks ago? Like, why are you here now? Oh, well, I wanted to be a better person 3 weeks ago, but last night my wife threw me out. Oh, okay, so you're here because you want to save your marriage. You're here because you don't want to get arrested again. You're here because you don't want to give another person HIV. I can help you do that. Once I am very clear about that bottom line goal, then I can confront behavior, because then I'm always on their side. And they say, well, I don't want to give up porn. Porn wasn't a problem. And I say, well, but that porn seemed to lead to prostitutes. Prostitutes seem to lead to the destruction of your marriage. Maybe the porn isn't a good idea for you. And they can say, you're just anti-porn, or you're too conservative, I can say, well, no, I want you to save your marriage. That was your goal, right? So as long as I am very clear on that, I can confront problem behavior and not get in a power struggle. And that is the most important part of the work, because I don't want to be in a power struggle with these folks. Narcissistic parenting is when you're my child and my needs come before yours. So you come home from school and you say, Daddy, Daddy, I had such a great day at school. I want to tell you about it. And I say, listen, kid, you had a great day, but let me tell you about my day. So the focus is me. And if you're not listening to me, kid, I'm telling you a story. I want you to listen right now. So the child doesn't learn that the most precious and important thing is this.
So would that child grow up to be narcissistic if it's a male?
They will grow up with attachment issues, and depending on the individual. I mean, we're very hardy people. We often will find somebody, a nanny, a nurse, a friend of the family, a neighbor, someone who will parent us, and if they do a good enough job of it, we'll be less scathed, less harmed. But you can read about narcissistic parenting in Alice Miller, someone give me the title. The Drama of the Gifted Child is probably the best, earliest. But what happens is the child's reality becomes warped because they don't learn that they are loved because they exist. They learn that they're loved because they can perform a function for other people. And then they just continue to try to figure out what that function is. But this is empty. And when addicts talk about the hole in the soul, or the donut hole inside of them, they're often talking about that empty self. I can make you happy all day long, but I have no idea what I want or need or what makes me happy about it, except drinking, or using, or like that. Any other quick questions before we stop? Yes, ma'am.
I'm not in the treatment field or probation officers supervising sex offenders.
So your offender work, right, which is not what I'm talking about today.
No, but it was very helpful
Yeah.
in the fact that,
Well, we do the same work.
yeah. So
Yeah, and that would be my question, how do you treat a pedophile that has sexual addiction?
Well, it depends on your setting, right? Because most offender settings won't talk about this, won't deal with it, won't have anything to do with it. And then it depends on your pedophile. Do you have a dedicated pedophile? Do you have a regressed or situational pedophile? Dedicated pedophiles are not treatable, but most of them are. So in a very similar way to the way you would treat one. The funny thing about the offender world and the addiction field is that the offender world says that they don't want anything to do with the addiction world, all the labeling and stuff, but we do the very similar work. We do cognitive behavioral, structured, accountability-based, breaking denial. The only difference is that we're very 12-step focused. And so we really put a value on people coming together after treatment because we know this is a lifelong problem. And that's actually my issue with the offender world, no offense to you guys, is that oftentimes you're not encouraged to put people in meetings because there's the fear that, they'll come together and they'll figure out how to molest children as groups and, somehow they'll find each other. And I just don't think, I think it's much more likely the case that they're going to go there seeking other people who are trying to not act out sexually. And 12-step recovery, I think, is really, really important piece that's missing from the offender world. But other than that, we're very similar, very, very similar.